Hello, this is a quick video to debunk some of the awful myths that surround hepatitis B. These myths cause tremendous stigmatization. They also cause tremendous sorrow, confusion, depression. I've even seen suicide. So let's get started talking about the nature of the stigma and why it has no right to be there. First of all, what is the Hep B pandemic? Who gets it? What's it about? Basically, it's a child pandemic. In highly endemic areas, Hep B is most commonly caught small babies and small children. It's estimated up to 75% of chronic Hep B is caught by small children. That's at least 220 million small kids catching this virus. It's got nothing to do with anything bad. They're just beautiful, small, lovely kids who catch a blood virus. Now, what is the main driver of these infections is a really important thing to understand. Children didn't do anything wrong. Most of them were victims of healthcare injections. In 2000, the World Health Organization and many organizations understood that up to 21 million people were injected with hepatitis B. And healthcare injections, reused medical syringes, account for 32% of the total infections of Hep B, or 640 million infections are caught from reused medical syringes. Moving on. Now, 21 million a year times 50 years is 1 billion infections, or 150 million chronic Hep B cases. That's where the main amount of Hep B comes from. People who catch Hep B are completely innocent. They are just small children or people that trusted their doctors. Two very innocent things that we all do. Now, one of the first myths that ruins people's lives who have Hep B is the assumption that somehow it's because of injecting drug use. And, you know, many of the best doctors will mumble this nonsense. If we do a little bit of math on the left, around the world there are 15 million injecting drug users. The estimate is about 4.5% of them have hepatitis B. This gives you a total of only 350,000 chronic Hep B cases from injecting drug use in the whole world. So you basically, for every addict with chronic Hep B, there are 450 healthcare patients who've been injected Hep B. That's the balance of it. And there are 1,000 or towards 1,000 of the general public, the children, public, who've caught Hep B. But this 1 in 1,000 drug addicts somehow has been allowed to colour and stigmatize this pandemic. It's a little graph. These are the number of infections from reused medical syringes. We're estimating 150 million infections from healthcare settings. And there's your 300,000 from drug abuse, addiction, injecting. It's incredible that people think, oh, it's to do with injecting drug use, and yet that's the fact. You can't even see it next to the number of people who've caught it from healthcare settings. It's insane. The lexicon we use has created the stigma. Moving on. Of course, to the reused syringe medical infections, we need to add infections from surgical equipment, infections from transfusions and blood products, infections from dentists, and infections from reused medical ampoules where they push the syringe into a bottle over and over. Towards 1 billion healthcare infections. And a lack of candor about this is why there's a stigma about Hep B. And we have no right to ever imagine that the one injector should colour the 1,000 who don't inject. It's insane. Moving on. 1 in 4 humans have caught Hep B. They're not a marginal group. We must never call them, other, abnormal, on the edge. There are species. There are children. All they did was get born, see a doctor, and on occasion bleed. Moving on, the next myth that's very common, sorry, I'm moving me about, is sex. Now, the problem with assuming it's all about sex, if we look here at the latest NHS nonsense, which is horribly stigmatizing, here it is. Hep B is caused by blood, semen and vaginal fluids. You can get it from oral sex, anal sex, vaginal sex. You can get it from injecting drugs. You can get it from being injured with a needle. You can get it from a tattoo. And at the bottom, there's a little mumble about transfusions overseas. And at the bottom of that, you could get it from your mum. So immediately, the NHS is creating this idiot idea that gives an unhygienic, oversexed, tattooed drug addict pretty much as the face of the world's largest child blood virus. It's quite stupendous. And 95 to 98% of adults who catch Hep B will clear it. And 90% of Hep B mums will notice they haven't infected their spouses. So this idea that it's all about sex is coming directly from this misinformation. If we look at the NHS's reports, over the last 30 years, there's about 500 acute Hep B infections a year reported. About 250 of those we could assume are from sex. With 95% clearing, that means just 12 people a year get chronic Hep B from sex. Now, add that up, it means only 375 people got Hep B from sex out of the 200,000 to 400,000 with Hep B in the UK today. Why would 1 in 100, less than 1 in 100, define how you get it? Obviously, this is the kind of insanity that's broken out. And we wonder why Hep B's got a stigma. 375 chronic sexual infections have eclipsed up to 400,000 really good people. We've got this image of the sexy junkie down here covering up 400,000 people who just are not at all like that. They're normal people. In fact, it's very important to realize who does catch Hep B. And I always use this, that 33% went to a doctor. That's how they got Hep B. And then you've got blood transfusions giving 5-10% more infections. Unvaccinated childhood cuts and scrapes. It's a child virus. Being born, needle stick injuries, tattoos, piercings, barber shavings, beauty Botox, fillers. These are the people that ring more than 10,000 times the UK Hep B helpline with infections. Boxers, wrestlers, rugby, judo, karate, mountaineering have all rung with lots of infections. Travel to endemic areas unvaccinated. Policemen have rung, security guards, cleaning of first aiders, professions that use and bleed with their tools, like chefs, builders, glaziers, dressmakers. All these people are ringing with lots of infections. Forgetting your plasters. And then at the bottom, unprotected sex with a high level of Hep B DNA and sharing home razors, glucose, cholesterol syrettes, and drug syringes. But that is the correct way to define how people catch Hep B. And it's never happened. Moving on. So, myth number 3, and this is another one that destroys a lot of lives, is the idea that Hep B is 50 to 100 times more infectious than HIV. And this is trumpeted by all our major organizations. They idiotically spew out this nonsense. And the fact is, it comes from needle stick training manuals. That following a nurse sticking a syringe in herself by accident, Hep B on that syringe is 50 to 100 times more infectious than HIV. It's not about sex. The whole world reads this line and hates people with Hep B without even understanding that, well, hang on, people with Hep B are not walking around with syringes that they're going to prick you with. It's just insane. Hepatitis B is less sexually infectious than HIV. But the curse of this comment, and the fact that it's a lie, that it sounds like Hep B is so much more socially transmissible than HIV sexually, has created incredible stigma. Whole lives have been destroyed by this. Moving on. Sorry, helpline member. Hep B is 50 to 100 times more than HIV infectious. And if you look here, this is a lie. And we've had to do therapy to 60,000 people with Hep B. And I always ask this one line, how much has that hurt you? It's often the defining line of their suffering. They're not physically ill, but their lives are ruined by this one line. And it's simply not true. They're walking around thinking, well, I can never live a life normally because of a lie. Moving on. Right, and saliva is another myth that destroys lives. And this, sadly, is very much from the WHO website. Our babbling saliva. What they forget to say is that Hep B is 1 to 10,000 times less present in saliva. So you basically can't get Hep B from saliva. Crucial point. The effects of this lie are just devastating. And, we teamed up with Hepatitis Australia, and you can see here they're literally bellowing, no one, misinformation about viral hepatitis increases the stigma. And the evidence shows that saliva can contain but not transmit the virus. And they went through, I think, all the literature on Earth. And in 50 years, there was only one identified case where it's a high possibility that it's from saliva. Amongst 2 billion infections, they could only find one person mumbling that they might have got it from this source. And this is frankly ridiculous. It's a stigma that has to end. Moving on. And we at the Hep B Trust have found people disowned, partnerless, childless, schoolless, unable to kiss or touch, living in a shed with a bucket, all these things. Even whole countries like the Philippines where work and travel is more or less banned, all because of this nonsense that they think Hep B is in saliva. Moving on. So why has Hep B become so stigmatized? And in closing, a lack of candor about up to a billion healthcare transmissions, a total misunderstanding that 1.5 billion children have been infected, the fact that drug and sexual health agencies have claimed Hep B instead of child professionals, key stigma whispers of sex and drugs, bad people, super infectious, in saliva. Medical staff learn HIV, then Hep C, and there's this thing where it's, Hep B's a bit of both. Amazing how often you find that total fail attitude. And in the West, we have good categorization of sexual and drug health, massive industries studying those. No one has really investigated child-acquired Hep B properly. So, moving on, ending stigma. Let's end the stigma with the correct lexicon and candor about 1 billion healthcare infections and loving kindness to toddlers and their families. Thank you.